Hi, good morning Alberto. My name is Davinaldo. I'm your invigilator for the OET speaking session on the 19th of January 2021. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Alberto Megan.
And what is your candidate number, please?
My candidate number is 2133194.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
How would you handle a complaint from a family member?
In my externship, we only saw the families occasionally. There was one family member who was demanding certain services for their relatives, but my supervisor and I weren't authorized to give those services. So, we explained this politely to the family member and got in touch with the head nurse, who was able to straighten it out from there. As a practical nurse, I want to be responsive to family members, since I know it is difficult to see a loved one suffering. I also want to always be polite, so that I represent the facility well.
What's the hardest decision you have ever made in your career?
It was during my initial year after graduation. My coworker went to the washroom, so I was alone in the duty room. At that time, a patient in the ward wasn't doing well. The patient was losing himself. I panicked and stopped for a moment. Suddenly, I heard the word doctor. I just called the doctor to report the incident. However, I went with my gut, and it turned out to be right. By the time my coworker returned, and the patient was shifted to the ICU.
How do you define great patient care?
It is important that great patient care is a major focus for most healthcare workers and organizations. I believe great patient care means that you are patient-centered. It points out that patients is the utmost priority. Hence, we should address their concerns and respond as quickly as we can to their needs. It is also important that we should take time to educate them, so that they know what exactly is happening. When they leave, they should feel they were taken care of to our best, and hence, making our effort meaningful.
How do you contribute to the well-being of your patients?
When I am on duty, I try to do everything that I can to make the patients comfortable. It starts with listening. I listen to them and take the time to understand their problems. By the end of the step, I will build a rapport with the patients. I look after their needs and inform the doctors about issues they are facing. Providing assurance and empathy is the initial relief for the patient and their family. And above all, I complete each and every duty assigned to me in the best possible way.
In such a highly stressful job as nursing, how do you take care of yourself, physically and mentally?
Before taking care of others, one needs to take care of themselves really well. To cope up with a physically and emotionally demanding job like nursing, I pay a good amount of attention to my well-being. When I am not working, I relax with my family, take time for my hobbies, and visit friends. I also maintain a healthy diet to stay fit and exercise the best practices for personal hygiene. I am a positive person, and my loving passion for my job help me cope better in stressful situations.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patients or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hi Davina, good morning. I am Alberto, and I will be your nurse here today. How are you feeling now?
Good morning, nurse. I'm all right.
You seem to be upset. If you don't mind, may I know the reason, please?
Yes, I would like to get the discharge today itself.
Okay. I hear what you say. May I know the reason for getting discharged today itself?
I really wish to be with my family. I will take care of myself at home.
Okay. If I were you, I would feel the same. However, your current health condition is not satisfactory. Hence, the doctor could not provide a discharge for you today.
I don't wish to stay in the hospital anymore.
Davina, please calm down. For better understanding, may I know, is there anything else, being the reason for getting a discharge? I mean, like, you are not satisfied by the hospital, or something.
No, nothing else. My concern is all about my family.
Thank you for the clarification. Your concern is understandable. However, you should also consider your health.
If I am home, I can take care of my family, and at the same time, I can continue the treatment.
Before making a decision, I would like to explain to you the reason why the doctor asked you to stay in the hospital. Shall I proceed?
You may carry on.
Great. Thank you for your willingness to hear me. At present, your body is rejecting food and fluids. So, oral medications are not possible. Hence, you are currently undergoing intravenous therapy. Also, close monitoring of blood and urine is essential in this stage, to trace the infection. Therefore, in this situation, staying in the hospital is the best and safest option.
I can't think of staying in the hospital. Treatment can even be continued at home, with home visits as well.
Davina, there are some risks involved, if you move forward with the decision. Kindly be patient and listen to me.
What are you trying to explain to me?
Yes, is it okay to discuss the risks involved in the current situation?
Okay, I will listen. Tell me.
Thank you, Davina. You were diagnosed with kidney inflammation due to a bacterial infection. Still, the infection is not under control. In this stage, if you get discharged from the hospital, there is a higher chance for potential kidney failure.
Oh, is it?
Yes. And if the kidney fails to perform its functions, the risk of blood poisoning is high. And, we have limitations to provide treatment and care at home in such a situation.
All right.
If you could stay in the hospital till your health is satisfactory, you could lead a peaceful and hassle-free life. Am I clear for you, Davina?
Yes, what you have said is right. But my husband can't manage our children and home, along with his busy work schedule. Children too need me for support. So, I need to get discharged.
I appreciate your thoughts. What I could do is that the hospital can arrange someone for help at home. Doesn't that sound good, Davina?
Okay. That will be helpful.
If the treatment can be done without any interruptions, it won't take too long for you to get better.
Okay. I got it.
For your clarification, intravenous therapy, proper medication, close monitoring of blood and urine, and recording and reporting them on time, are all inevitable in your treatment. Hence, the hospital stay is a must for you at this stage. I hope I am clear to you.
Yes, you are. Okay, I'll stay in the hospital as you suggest.
Thank you for listening to me and accepting my suggestion. I wish you a quick recovery and start feeling well very soon. Meantime, I can arrange for a social worker to take care of your family.
Thank you, nurse.
You are very welcome.
That is the end of your OIT speaking roleplay. All the very best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.